Okay, cool. I am here. I am at the user conference here in Orlando. I've arrived at the Marriott Conference Center here, and so I thought I might just talk a little bit about how we kind of slowly went into implementing advanced team-based care when we arrived back from the conference in Green Bay. So, you know, what it boiled down to was trying to find a way to get, especially the medical assistants. So the first person that's got to sort of change what they do is the medical assistant, and so and then the doctor has to adapt to allowing the medical assistant to perform a variety of different tasks. So, you know, and there's got to be some trust, and that trust is not gonna develop overnight. And so the way we basically did it was to write down. So I would see a patient, and my medical assistant at that point was Nancy, and Nancy would execute it. So I'd write down, okay, I prescribed this medication and I made this referral and they need a follow-up appointment in a month. And I'd hand that slip of paper to Nancy and she would make sure it got done. So that worked out pretty well, and I was amazed at how quickly she was able to do that. And then we started to say, okay, well, what about just some pre-visit planning? So what Nancy would do is she'd look at the chart and see who needed what immunizations. Were they up to date on their mammogram? Were they up to date on their colonoscopies? And so she would go ahead and take care of those things when she roomed the patient. She would make the mammogram, write down that they need the mammogram. She would refer for the colonoscopy, and she'd do those things before I even got in the room. And so again, increasing comfort that she kind of had these tasks at hand and were able to do them. And then the next phase was to have her come in the room. And so at the same time for us, when we got back from the conference, I had hired an RN to do co-visits with the RN. And this is something that Bellin Health had been doing for years. And so the approach was for highly complex patients to have the RN go ahead and, I mean, almost like a resident, reconcile medications, do vitals, and especially for Medicare well visits. Those were probably the most important visits for her to do. And what it did was it allowed her to get to know the patients real well. So she would do a Medicare well, get to know the patient. It would take, you know, up to 45 minutes for her to go over all the gaps in care. Do they need a colonoscopy? Do they need, do they have their advanced directives, their living will, durable power of attorney? Have they been screened to see if they have problems with dementia? So she took a lot of time looking at that, at Cerner, our hospital record. And so she would get all that information for me, go over any problems. So if we started a patient on a blood pressure medicine, was that working? If they were on an antidepressant, are they still depressed? We would do a depression survey on the patients and see, do they still have signs of depression? And so she would have all that queued up. And then when I went in the room, she would present the patient to me, and the patient really felt cared for. Having that second person in the room really does make a difference as well. You know, we just collaborate and talk, and especially after years and years. So we've been doing it for almost 4 years now, and the patients know Kimberly, my RN, really well, and so they feel very comfortable that they're going to get what they need from her. So that's so important to and especially with regards to our quality measures. We're a part of an accountable care organization, and in an accountable care organization, you want to be sure that you're not only taking care of the patients, but also that, you know, not only taking care of the patients when you're in the room with them, but you want to make sure that they can get in to see you anytime they need to. If they're discharged from the hospital, you want to make sure that they're able to see you when they're discharged from the hospital. You want to make sure that they are able to if they're in an assisted living facility, or they're in a if they have to go to physical therapy, or they have to be admitted to a rehab center, you want to make sure that you know what's going on. If they're on home health, that was an invaluable thing that Kimberly would do, is she managed all the home health referrals. So she would make sure that if someone was receiving home health, that they were getting what they needed. They had a good care plan, that the lines of communication between the home health agency and our team were wide open. And because of that, we were able to really be very efficient with our utilization of home health. So, and then transition of care visits were really improved. So she would be watching patients. We got records for when the patients were in the hospital. She would be watching closely what the discharge plans were. And then she'd be calling the patient the day or two after they got discharged from the hospital and setting up a follow-up visit. Really, really important. So getting the medical assistant up to speed, and then having the RN was a critical part of us moving to this advanced team-based care. So we'll talk a little bit more about kind of how things have evolved over the last 3 years. Thanks.